tests. I think I'm now up to 4 tests since the pandemic started. And I'm proud to say that I am negative. All right. With that, who am I handing the ball to? Am I handing it to my wife?
Yes, you are.
Okay, this is Sister Renee Brokeleg Beeman, and she will take it at this point. Brokeleg?
You're funny. Good evening, Bethel family, and welcome to the Faith and Facts preparation for fall winter season COVID-19 Bethel Family Town Hall meeting. I know that's a mouthful, but we do want to thank our pastor for his support during this pandemic and permission to host tonight's meeting. Next slide. Tonight, we will be blessed by presentations by Dr. Velma Scatterberry White, Dr. Carol Guy, and Sister Angelique Davis Williams. Next slide. Never did we think that we would still be in this COVID-19 pandemic 9 months later. Tonight, we will share information that hopefully can empower you and give you prevention tools for you and your family, especially as you prepare for the holiday season. Special thanks to our Bethel COVID-19 Task Force, who have been meeting twice a month since this spring, and their dedication to keeping Bethel's membership safe. Thank you to the members who participated in the beta test and the soft reopening worship experiences. We are now suspending reopening, which we will explain later. COVID-19 has impacted our membership. We haven't had any traces of infection from our worship location, but we have had many members who have tested positive, some who have had no symptoms, some who have had mild symptoms, some who have been hospitalized, and sadly, we have lost members. I listened today to gospel legend Frank Hammond as he shared his testimony of dropping his guard and now that he is COVID positive. As we all are COVID fatigued, we must continue to be dedicated and wear our mask properly when not with household family members. Again, we must wear our mask when we are not with our household members. Continue to social distance, as 6 feet can help prevent you from getting COVID, and to wash your hands frequently. Add frequent COVID testing to your schedule. That COVID test that you took back in May or July cannot give you the information of your COVID status today. We are blessed to have free testing available every day in Delaware. Please get tested. Please visit our church website and click on the reopening box on the homepage, which can give you more information that we put together regarding COVID. Tonight's presentation will be recorded and posted on the website, and we will highlight the increase of COVID-19 rates, vaccines for COVID-19 and the flu, and a Q&A period. We will also have a special interview with a member who was diagnosed with COVID-19. The question and answer period will be at the end, but you can place at any time your questions in the chat box. Or if you're on the phone line, you can write them down, as we will attempt to open the phone lines at the end to entertain questions. You can also send an email to the team's secure email address after today's presentation, and it will be given at the end, and you can also find it on the website. Thank you, Brother Bill, for your technological help tonight as we move forward. Next slide. Our next presenter will be Dr. Velma Scatterberry White.
Thank you so much, Sister Renee. Thank you, guys. Thank you, Bethel, Pastor Beeman, to all the members on the line and guests. I will give you some statistics on COVID-19. Next slide, please. Here in the state of Delaware, the update as far as infections in Delaware, new cases as we reported as of yesterday were 405. As we can see on the graph to your right, that certainly the trend is increasing. Currently hospitalized are 130, with 22 that are critically ill. Unfortunately, there have been significant outbreaks in long-term care facilities between September and November. Places such as Kentmer Rehab in Wilmington, 54 residents and 43 staff members. Cadia, 45 with 35 staff members, and some others as listed there. And to your right, you will see that as far as schools and for kids from childcare to high school K through 12, the weekly total for last week were 10 students and 10 staff within childcare facilities. And in the private schools, no staff, but mostly students positive. And in the public schools, we have more staff that are positive and students as well. And these are the cumulative cases within the school system from September to November 12th. So we can see that the numbers are increasing as we let our guard down and as we go into the season of cold and flu as well as COVID. Next slide, please. And so to bring this home, if we look at positive cases on the back in July and the top graph, we see that the total number of cases in July, when we really thought we were just beginning to climb the hill and be over, was 14,000 in the state with a rate of 149.6 per 10,000 population. And now here in November, as of yesterday, the total positive cases have doubled, 28,000 people, with the rate of 305.3 per 10,000 population. So certainly there's increasing numbers of those who are testing positive. Certainly there's more tests, but there's also more people contracting COVID-19. Next slide, please. And as we look at this a little bit closer, we see that Newcastle County accounts for, comparing July on your left to November on your right, the numbers in Newcastle County is certainly significantly higher than those in Kent and Sussex County, and a few unknown. So we need to continue to be vigilant. As you see, also the number of long-term care facilities increased in those numbers as well. Next slide. And unfortunately, while there are not as many deaths as before, we still see that by age group, the greater than 65 age group and the comorbidities that go along with patients who are over 65 continues to account for the majority of deaths when we look at across the state of Delaware. So this gives us something to consider if you have other comorbidities such as asthma, diabetes, high blood pressure, things that could affect your ability to recover, especially within the African American, Black and Brown communities. Next slide. So when we look at venues in terms of cases from last week who were positive, certainly we find that the majority of venues were people going to restaurants who choose to eat out as opposed to staying home. You can wear your mask if you're among your family, but when you take that mask off and you are in the vicinity of those who you think may be your friends, may not live, maybe your family, but not living in the same household, you're going to be subjecting yourself to that close proximity and possibility of getting COVID. House parties. So you decide to stay home, but you have everyone come over, and certainly you're going to increase your risk there. Church gatherings and other hair salons, getting your nails done. Religious services were only 11, and you see the numbers go down. Anything beyond that was less than 5. And so it becomes important when you're gathering together that you be cognizant of the fact of those who you are around if you're not living in the same household. Next slide, please. And so we realize that while we may continue to, we have to be vigilant about protecting ourselves, not touching your face and your hands, or if you use the telephone or you're in public places, you touching commonalities such as doors, that to use hand sanitizer and not transfer those germs from the surfaces to you or your phone and then to your mouth or nose and your face. Next slide, please. So we saw this before, that we need to maintain your distance. If you are wearing your mask, bottom line is you are protecting yourself. Your very high or high rate of transmission is because will be for those who choose not to wear a mask. Your low rates will be even lower if you are wearing a mask and are 6 feet apart from the next person. Next slide, please. So wearing a mask saves lives. We know that if everyone in this country wears a mask, we can have less deaths and less people contracting, as many as nearly 100,000 people may still be alive at the end of the year, because if everyone wear a mask and then not expose others. So wear a mask, a face covering, wash your hands, stay at home, keep your distance, just as we've been saying before. Avoid crowded places, avoid gathering with others, especially with this Thanksgiving holiday and Christmas coming up. If you want to be safe and you want to be able to see your family in 2021, do your best in 2020. So next slide, please, and I will pass it back to Sister Renee.
Thank you, Bill. I needed to get unmuted.
Okay.
We have the opportunity to have a brief interview with one of our members. I want to make sure she is unmuted as well. Good evening, Sister Pierre, and thank you for agreeing to share your story about COVID-19 with the Bethel family. I'm going to just ask you a few questions and have you to share that.
Pierre,
So,
Sister Renee, I'm sorry.
go
Pierre,
ahead.
you have to respond to the screen. It's asking you to unmute. On your phone device.
We'll wait till she gets unmuted.
Okay, Pierre, I'm going to unmute your tablet. It's asking you the same question.
We can,
Pierre, you're going to need to use your telephone. If you pick up your phone, it's
there you go.
there we go.
We can hear you.
We can hear you
Yeah,
now.
we can hear you. You might talk just a little bit louder. So again, I want to thank you, Pierre, for sharing your experience with COVID-19. Are you ready for some of the questions? What we're going to do, we're going to move forward. We're going to work with Pierre. So why don't we continue with the presentation, because I can't hear. All righty. So we're going to turn the presentation over. Dr. Carol Guy, can you continue? Next slide, please.
You're a little bit low, but we can hear you. Sister Carol.
Can you hear me?
Here, we can hear you. Sister Carol,
Can you hear
please
me?
respond. Sister Carol, please respond to your screen.
Okay, am I unmuted now?
Yes, you're unmuted.
Okay.
Thank you.
Next slide, please. So, good evening, Bethel family, Pastor Beeman, Sister Renee, and all my fellow Bethelites. My topic is going to be about vaccination. So we need to prepare ourselves for upcoming vaccinations, which should be soon. If you saw the news today, that was all the talk on the news about the upcoming vaccines. And in New York, Governor Cuomo was on the news today discussing that it's extraordinarily important that our Black and brown communities receive vaccination. They should be fast coming, which is the good news. Our Black and brown communities suffered the most so far during this COVID COVID-19 pandemic, and we want to make sure we have equity with these vaccinations that should be coming soon. So the questions people are asking, including myself, should be, why should I receive the COVID-19 vaccine, immunization, or shot when it is available? We want to protect yourself from serious illness or hospitalization from COVID-19. You want to reduce your chance of spreading COVID-19 to more vulnerable persons in your community. We want to protect our loved ones. And we want to avoid missing work, because if we miss work, that's lost income, and school, lost learning. We urgently need vaccines to combat the escalating cases, which Dr. Scanberry just showed us, in deaths worldwide and right here in the state of Delaware. Next slide, please. In the meanwhile, as Dr. Scanberry told us, while we're waiting for these vaccines, and when we have these vaccines, wear a mask. Models estimate that if we universally wore a mask, that it was 95% of us wore masks, we could save 130,000 lives, which started back in September, going forward to February. Next slide, please. So what is Delaware doing to get ready for these vaccinations? They have an extensive plan. You can go to coronavirus.delaware.gov to review their tentative plan as how the vaccines will be distributed. It will be done in 3 phases. The first phase will be given to healthcare workers, which would include those who care for vulnerable populations and other first responders, including critical infrastructure workers. Then we'll get to vulnerable populations. And last, the general population will be vaccinated. So it will be done in tiers. Next slide, please. There's a lot of news and social media talk about vaccine development. The good news is we've had record development of these vaccines, and I'll get to 2 promising vaccines at the end, and one of them is all over the news today, the one by Moderna. Even though there's rapid development, we are following scientific guidelines. It's just all these things are colliding in a good way to make the vaccine development quick. The problem was urgent. This pandemic is deadly. There's something called translational research, which has been going on for many years, where scientists try to get new medicines, new vaccines quickly from what we call the bench, where the research is done, starting with animal models to humans, to the bedside. And many centers all around the world already had translational research centers in place. And so when this pandemic came along, it was a way to really put these things on steroids and get this up to speed. And the government, including the United States administration, is presently in power, actually has funded some of these things. So what is being done with COVID-19 vaccine development? There's preclinical stage where vaccine candidates are tested on cells and animals. Then you have phase 1 and 2 trials. In phase 1 trials, scientists give the vaccine to volunteer candidates to test the safety and the dose to see if it stimulates the immune system and see if it's safe. When the immune system is your body's way of fighting infection. So it's the way it can fight the COVID-19 virus with your own system. It revs up and fights the virus. There's small numbers in these phase 1 trials, and it's a very small group of people, usually just healthy volunteers. And that we don't use patients who are older or who have comorbid disease. We want to just see if the vaccine works, the candidate vaccine works, and if it's safe. Then we move on to phase 2 trials, where scientists give it to 100 of volunteer candidates to continue to test safety and to see if the dose is effective. And if it stimulates, again, your immune system, which I said is it fights the infection. And we're still looking at safety. These are hundreds of people, but in these phase 2 trials, we actually increase who we give it to. We give it to a more general group of people. So we would give it to elderly persons, for example, to see if it will work the same in that group of patients. So as we know, sometimes things will have to change when you give it to a larger group of patients. Like we know in influenza vaccine, elderly patients need a sort of different higher dose. In phase 3 trials, this is where 2 great trials are right now, which I'll show you at the end of this presentation. This is the final trial, the pivotal trials. So what you do is you give this candidate vaccine to a very large group of volunteers, and then you wait to see if they get infected. And you compare that to those who only receive what's called a placebo. A placebo is just like an injection with no real vaccine in it. It will probably have saline in it. These are thousands of people. And in these trials, you'll see if you have efficacy, if the vaccine works, and you can also detect rare side effects. Then after you go through these preclinical phase 1, phase 2, phase 3 trials, you get to approval stage where your trials are reviewed, and during this whole process, they're reviewed by the Food and Drug Administration. And during the pandemic, they're going to be reviewed by the emergency use authorization if you want to get it to us, the public, in a timely fashion. The FDA has told us that they will accept 50% efficacy from the candidate vaccines. They also require a 2-month monitoring period. So the myths and rumors about, perhaps how are we doing these so fast? There are lots of guidelines around this, so we will ensure safety to the general public. In phase 4, after the vaccine is licensed, there will be continued ongoing monitoring to detect any new safety issues. Next slide, please. So these trials are regulated. The main regulatory body is the Food and Drug Administration. And during this COVID-19 pandemic, there's been an additional committee that's formed because we will need emergency use authorization so that we can get the vaccine in a timely fashion. The Vaccine and Biologic Products was formed to do this. And these vaccines candidates are undergoing the normal processes where we have internal regulation boards, a committee, which look at safety and also look at efficacy. And they also, in that safety measure, they look at to make sure that, for example, candidate volunteers are informed. They have to sign informed consent, and the fact that they really are informed. Also, if there's a safety signal during the trials, they will stop or pause the trial. And I'll show you one slide where that was done and it's been resumed. And that was an AstraZeneca trial. So some people are concerned too, that if you give the vaccine to, we got over 300 million people right here in the US, right? So when you give a vaccine, there can be safety concerns, and it could be 1 in millions, but how will that be dealt with? So compensation for vaccine injury in the US. The Public Readiness and Preparedness Act provides immunity from lawsuits related to injury caused by vaccines with narrow exception. People injured in the US by COVID-19 vaccines must file claims with a fund administered by the Department of Health and Human Services. One thing that is near and dear to me as a brown person is that how will lower income countries, how will they deal with that? So there's been the COVAX facility is an international partnership which aims to financially assist vaccine candidates in access to vaccines in lower income countries. Next slide, please. So there are lots and lots of trials. So there are 54 clinical trials worldwide. 87 are preclinical. They're still in the animal stage. There are 39 in phase 1, 16 in phase 2, 12 in phase 3. Remember, phase 3 are the ones that give the answer. There have been 6 limited use approvals, not in the United States, in China and Russia, but they've been approved without going through phase 3 trials. We will not do this in the United States. We want to ensure safety. And 0 have been approved for full use. Next slide, please. So the United States government has given billions and billions of dollars into vaccine funding. Moderna Pharmaceuticals, in partnership with the National Institutes of Health, which is the government organization, received $1 billion support, and $1.5 billion was added in exchange for 100 million doses of vaccine if, and I say if, the vaccine proves to be safe and effective. Pfizer and BioNTech, which is a partnership now, has received 1.9 billion for 100 million doses, which may be delivered by December. And then they have an option to acquire more doses. Johnson & Johnson, you can look at the slide, 456 million, followed by 1 billion. AstraZeneca and University of Oxford, 1.2 billion for 300 million doses if the vaccine is safe and effective. So we want to emphasize that, if the vaccine is safe and effective. And because of those IRB boards who look at these trials, AstraZeneca, as we all saw in the news, did pause their study back in September because of one patient did develop a severe reaction, which was inflammation in their spinal nervous system, which has been seen with other vaccines. It was one patient, but they paused it, and after they looked, they had further review, and it was resumed in the United States in October. Next slide, please. So I'm just going to review real quickly 2 promising vaccine candidates. So one promising vaccine candidate, which is, you probably heard in the news, it was published in the New England Journal of Medicine, which is the premier medical journal. And it was titled Safety and Immunogenicity. That's a fancy term. It means just as fighting your immune system's fighting of 2 RNA-based COVID-19 vaccine candidates. And that's technical stuff. It's just the type of vaccine. It's called an RNA vaccine. And in the phase 1 and 2, there was no serious toxicity, and it had good immunogenicity. That means the body revved up and was ready to fight infection, the COVID-19. It was record time to development because, as I said, we have experience now. They have experience with messenger platforms to make the virus. They have rapid manufacturing. They've learned lessons learned from Ebola, lessons learned from the swine flu, many lessons learned in translational research centers, lots of funding. As I showed you, they have billions of dollars in funding. The news that we kind of knew would happen, but hopefully we can fix some of this. There were mostly white participants in the trials. There were only 3 Black participants, 7% in the phase 1/2, ages 18 to 55, and no Black participants aged 65 to 85. In our communities, we've had distrust for good reason of clinical trials, and we want to change that narrative and make sure we understand it. That's a whole nother discussion. Okay, now the recent phase 3 data from external independent committee which had over 43,000 participants. It's early, but it's not the final results, showed excellent efficacy of 90%. And that's been all over the news. And remember, we said the FDA only needs 50%. This is 90%, which is actually great for vaccine, way better than what influenza vaccine would be. They're going to need 2 full months of safety data, which they were there already, and they're going to be monitored for at least 2 years. And we anticipate that Pfizer and BioNTech will be making an emergency use authorization, which means maybe by December, we will have vaccination to be distributed. And Delaware has a plan, as I showed you in the first slide, but the first group will be those healthcare providers and first responders. Next slide, please. So another promising vaccine candidate was in the news today, which is great. So now we have 2 promising vaccine candidates that will likely be applying for emergency use authorization. And this is also the same kind of, a similar kind of vaccine to the one I just showed you. It's a fancy term. It's called a messenger RNA vaccine. That's just scientific fancy stuff. It's kind of the virus. It gets into the genetic material, which is the way your genetic material is what makes the virus or you yourselves who you are. So it's who the virus is. So in phase 1 trials, there were in healthy, remember I told you in phase 1, we used healthy people. So they were 18 to 55. They got 2 vaccinations 28 days apart with increasing dose. They did have fatigue, chills, headaches, myalgias, and pains. Myalgias are muscle aches, which we expect. That's not atypical. So some of these vaccines will likely have this. As if you guys have had, I'm sure everyone in the audience has had vaccinations. Some vaccinations don't give you much of anything. For example, influenza vaccine doesn't really give you much, but if you ever had a pneumococcal vaccine, for example, that may give you some of these same things. And it had an immune response, meaning that it worked, okay? There was no limiting safety concern. And this trial is being funded by the United States government through the National Institutes of Allergy and Infectious Disease, and Moderna Pharmaceuticals manufactured the vaccine and assisted with the trial design. And as I said, these vaccine trials are happening in record time, 2 months here, but it's nothing to be suspicious about. It's good science. It normally takes years, however, but now we have new techniques, we have funding, and this is a pandemic. So the phase 3 began in July. it was reported today or yesterday on the news that this vaccine also has excellent efficacy. It's 94%. So now we need to wait to see, and I suspect that Moderna, along with AstraZeneca, will also be applying for an emergency use authorization. So there's great promise on the horizon for some upcoming vaccines in the very near future. Thank you. Next slide. So next we're going to have Sister Angelique Davis Williams, who will tell us about influenza vaccine.
Hi, good morning, everyone. Can everyone hear me?
I can hear you.
I'm good?
Yes, you're good.
Okay, awesome. So next slide. So we're approaching, well, we're in the influenza, the flu season. So the flu is caused by several viruses, type A, B, C, and mostly we're aware of the type A and B, which is in the current vaccines. That virus, plus we are aware of the COVID, which is, that virus is called a severe acute respiratory syndrome COVID coronavirus 2. They're both very contagious respiratory viruses, and the transmission, respiratory droplets, cough and sneeze, or contacting a surface. I do want to emphasize that because the symptoms of the flu and COVID-19 are so similar, it may be hard to tell the difference based on symptoms alone, and testing may be needed to help confirm a diagnosis. All of this can put additional strain on our already overwhelmed healthcare workers and laboratories. So getting yourself vaccinated for the flu virus is so important. And we are, I put on here some symptoms that a lot of us are already familiar with the symptoms of the flu. I do want to highlight one of the symptoms that is shown to be very telltale for COVID-19 is this loss of taste or smell. Next slide. So the something called incubation time. Just to briefly tell you, it is a time from when you're exposed to whatever infectious process to when you actually develop symptoms. And for the flu, it could be from 1 to 4 days. A lot of times by day 2, you start having symptoms. For the COVID, is a longer incubation time. You could get exposed to this virus and then won't get any symptoms up to 14 days. Most people by 5 to 7, which is wearing the mask. The distancing is so very important, that hand hygiene. The difference is that we're seeing more COVID-19 is the older age and underlying conditions. For flu, children, pregnant women, elderly, those with underlying medical conditions and immunocompromised usually have a more risk of more severe influenza infection and complication. Next slide. So as far as the burden of illness the flu has on the US, the CDC for the 2018 and 2019, comparing it to 2019 and 2020, looking at people getting sick with the flu, going to see a healthcare provider, hospitalizations, and death from the flu. If you look at 2018-19 to 2019-2020 seasons, we went from 35.5 million to 38 people getting sick from the flu. Went from 16.5 to 18 million seeing their provider. And I want to highlight how the COVID has impacted data collection. And so you see the disparity now for the hospitalization deaths from the influenza affected by the 2019-2020 data gathering. Because COVID came to the US, the first identified mid-January, and therefore the flu season was still going on. Flu season ends March, April. So January to that time, there was this overlap with these very two similar respiratory infections. And this is how this pandemic has impacted our data collecting. Now, hospitalization, we know it's going to be more than that when everything is finished. That's from influenza, 34,200, 2018, 2019. 22,000, but they're estimating could be up to 64,000. Next slide. So the influenza does cause high amount of deaths. The flu season starts in November, inclines December, peaks around February, next slide, and ends around March or April. How do we protect ourselves from the flu? Vaccination. Get, wash hands regularly, doing that 20-second washing, saying happy birthday twice. Avoid touching your eyes, nose, and mouth. Practice other good health habits: cleaning, disinfecting frequently, touch surfaces, home and work or school, especially when someone around you is ill. Getting plenty of sleep, managing your stress, drinking plenty of fluids, and eating nutritious food. Those latter things, sleep, stress reduction, fluids, and proper diet helps keeps your immune system nice and healthy. And if you're not feeling well, please stay home. Next slide. So for the vaccination, there are several different types of vaccination. Most of them does contain a degraded or killed virus. You're not getting the live active virus, so therefore you would not get the flu from the vaccine. I have to emphasize that. And they usually contain type 2 and type B. The pandemic that occurred in 2009 from the flu, that was type A, H1N1, and that's been in the vaccine subsequent. The vaccine is based on the previous season of what was isolated then, and they will use that to make up the vaccine for the upcoming season. So it's shown to reduce your illness. So if you get the vaccine, not that you won't catch the flu, but you'll have a less severity and even less duration, and maybe not even having that much of an illness, less hospitalization, and even a low risk of flu-related deaths. The CDC showed in 2018 and 2019, the flu season in the US, only 45.3% of adults over the age of 18 got vaccinated. The rates for ages 18 to 50 was even lower. And we're hoping that this will get better, especially for this year, because this year with the COVID-19 pandemic, the flu vaccine is so very important. It's recommended that you get the flu vaccine by September, end of October. But whenever you get it, we still give the flu vaccine. I'm a PA in primary care, and we still do the flu vaccine up until March. So, but you want to get it at this time because your body needs about 2 weeks to really develop that antibody that you need to protect yourself for when you actually get that live flu virus, to be able to combat it and to kill it. If you get it too early, June or July, they say that's sometimes too early because the flu season goes until April. And sometimes your immune system can kind of wane and you get not as much antibodies remaining, which is why every year you have to get the flu vaccine. So the flu vaccine does not cause a flu. It makes your immune system start working. You're getting this foreign body. Your body is seen as a foreign body. It doesn't know it's a killed or dead vaccine, or if it's actually a live virus. So your immune system is going to respond to that because it's a foreign body. And so the antibodies provide the protection that you need. For the first time getting a flu, you do not have those antibodies. So your antibodies is revving up. That process of making the antibodies can make you feel much like you're having, that you're getting sick. That achiness, chills, and fever, and that's a good sign. That means your immune system is working, is making these antibodies. But once the immune system realizes that, once this vaccine that contains not the true virus, it's not going to actually cause the flu symptoms because it's not the true virus. And after a while, few hours or a couple of days of this body chills or aches, you'll recover from it. So when you first get the vaccine, you may have that reaction of feeling a little sick, but subsequent years, because your immune system is kind of primed from previous years. So when you get that vaccine again, you're not kind of starting off from scratch, and you shouldn't really feel those symptoms like you had the first time. And obviously some people can get localized redness to the actual site of injection, and arm achiness that can definitely happen. And sometimes just taking some Tylenol after that can definitely help with it. So the vaccination for the flu is so very important. I recommend, we as the Bethel COVID Task Force recommend everyone to get the vaccine. The adults over 65, you get a high dose and children ages 6 months to 8 years old. If you haven't had 2 doses through your short life, that is 6 months to 8 years, you should get 2 doses, which should be a month apart. So therefore, you should start in September, have the child get a second dose in October, and then they're done. And once they get that first dose through that 6 month to 8 year period, they only have to get it once every year. So the Sister Renee has been working with trying to get for Bethel to host a flu clinic here. We haven't been successful. So therefore, we're encouraging everyone to make sure you get your flu vaccine. If anything changes, we will let you know. And I'll pass it on to, are we ready for our
Yes.
testimonials?
Yeah, thank you so much, Sister Angelique and Dr. Velma and Dr. Carol. Let's see if we can get Pierre back on. We're going to ask if those of you can stay with us to 8:15, we would appreciate it. Is Sister Pierre, do we have her audio?
Sister Perry.
As you know, while we're checking with her, Thanksgiving is next week. Christmas is almost just a month away. We know at yesterday during worship that a PowerPoint was presented to really encourage you to not sacrifice yourself for that turkey and that gathering. Family gatherings really have been a major source of infection. I know it's tough. I know we're all tired, but let's Zoom, let's talk. Let's do our very best not to put each other at risk. We cannot move forward in anything until we get COVID under control. We can't get back to work. We can't get back to school. We can't get back to our regular lives. And it does require all of us to do our part. So whatever you can, please do your best so that we can protect and respect each other. Is Sister Pierre available, Brother Bill?
Sister Perry, you're unmuted, but we can't hear you. Please try to speak a little bit louder.
Why don't we go into, and we're probably going to have to save this because we were able to go through that earlier, but we're having some audio issues. I'm sure she wouldn't mind if I share some of her story and if she's able to come on. Sister Pierre Angelique Bronson, who many of us know very well, she tested positive in May. She remembers that date. She told me she tested on May the 7th, and on May the 10th, she got her results. She had no idea that she was being tested. She had noted a flyer at her work. Many of you know that she works with the Department of Labor, and she saw that the testing was not too far from her work location. And she said she also felt that God was encouraging her to do that, even though she had no symptoms at that time. So she was really surprised when she was tested back in May. She had to quarantine for the 14 days. She did test negative about that 13th day, she tested negative. She had a nasal test, and many of you know there's nasal, saliva, or blood test. And often the nasal is considered the best test because it's able to pick up those cells. So both of her tests were nasal. She was very happy when it was negative. Now, we know people can have a variety of symptoms. She said she just really felt exhausted for a couple of days, but she was able to bounce back. When she was part of a contact tracing from Christiana Hospital from the day she tested positive. She was called every day to find out what her temperature was, if she knew any person or any way that she was exposed. And they did check on her for the 2 weeks. So they are continuing to do that either through Christiana Care or Public Health. In my talking with Pierre, she is very grateful that she was one who had mild symptoms. And she is one who encourages everyone to please wear your mask, social distance, hand wash. Pierre said even when she goes into the grocery store, she covers her hand over her mask. She's just so concerned. Her grandson she has custody of. He did not test positive. They kind of remain segregated in the home. So even though she was unable to personally share her story, she was willing to share it with me, and she wants others to know that this is serious. And she's just grateful to God that she did not have the seriousness or even lost her life as a result. So we thank God for his healing and her ability to be willing to share her story. So we're going to go into our Q&A. And again, you can put your questions into the chat room. Brother Bill, if you could put the screen up. And then we'll also try to get some open lines if you have any questions. Also wanted to show you our email address so that you can definitely send an email. So go back one slide, please, Bill. Thank you. So enter into the chat box if you have any questions that you have right now. And if you're on the phone lines, if you want to write down your question, we can open it up. But if we don't get to it, you can email us at reopeningtaskforce@bethelwilm.org, or you can actually find that on our Bethel website if you click the reopening page. So I'm going to ask Angelique if you can filter through and look at some of the questions and anything that you wanted to share. Thank you so much.
Okay, so Doctors Guy and Scallenberry has answered some question. I'll let them go ahead and read their answers to the first question. What type of exposure associated with visiting at a doctor's office?
That was, I answered that question. My answer was that the doctor's office usually should perform a screening. They should check your temperature, and if you have any symptoms, you should not be allowed into the office. The staff at the office take very high precautions in order to stay safe. Going to a restaurant exposes you to many people, including the waiter, the cook, and everyone who's handling your food. While your mask is off and you're eating with others, you can even have droplets from another table if someone is laughing or talking loudly that can be transmitted across to you. So while you're eating, you may be getting more than just your food.
Thank you. And just so you would know that Bethel, anyone comes into the Bethel facility, the annex or the sanctuary, there is always scanning done as far as questioning and temperature check. Angelique?
So I know we've answered some of these questions already, but I was just saying that if we could just review it. So those who are on the telephone, if we could just read it out so they can also hear the answer, okay? So the second question was, have the vaccines been tested statistically significant numbers for African-Americans? And when is testing performed of the higher risk population? And I'll leave it to Dr. Guy.
Right, so that's an excellent question. So in the phase 1 and 2 trials, there were not large numbers. There were really very small numbers of African Americans. I do not have access to the number of African Americans in Pfizer's trial, which had over 43,000 participants. There's been an external review of the data, but it has not been published in our medical literature yet. So that's preliminary results by an external review. They will have to do formal publishing before we'll know that answer, or someone has to publish it. I don't know those numbers. And then in the Moderna trial, which was just talked about today in the news, where they had over 30,000 participants in their phase 3 trials, that's not published either. What is published in our medical literature right now is the phase 1 and 2 data. The other data from the phase 3 trials, which are ongoing, but have accrued sufficient patients and have accrued sufficient cases of COVID-19 to make some assessment of efficacy, are not published yet. So I'm waiting anxiously to see that data and to see if they were better at recruiting Black and brown patients. And there were efforts to recruit Black and brown patients that we know from what's going on in the medical community. They made efforts to do so, but more effort needs to be done about recruiting Black and brown patients into clinical trials, particularly because this COVID-19 has disproportionately affected our communities. And as Governor Cuomo said today, we want to make sure that our Black and brown communities have access to these vaccines. And so it would be good to know how our communities responded also. So that's a great question.
Right.
And anything in regarding to the high-risk population?
Okay, right. So that's the other question. So in when you do a phase 1 trial, you don't put high-risk patients in it. Phase 2, from the data that I looked at, they did have elderly, they increased the age limits. Okay, so then in the phase 3, you're going to have a broader array, and those subsets are going to get answered in the phase 3 trials. That data has not been published yet. It's just only a review. As I said, the first one was reviewed by an external independent committee, the Pfizer data, and the other one, it was sort of the New York Times where Moderna was reported today. So we have to wait, and then we'll have access to that when it's published in the medical literature to know what those numbers are. And that's what the FDA will look at. They'll look at too, how did these vaccines function in patients with comorbid disease? How do the vaccines function in elderly patients? Those things will be answered. And because this is a pandemic, and it's they created what I said before, the emergency use authorization for these vaccines. Some of that answer will be hopefully available in those large trials, because they're very large. I said one was 43,000, one is 30,000. But there's also always what we call post-marketing, which is after you have a drug or a vaccine, you look to see the more as you continue to give the drug and other evidence occurs. And so it still gets looked at even after it gets licensed. So what the FDA has concluded is we have to have at least 2 months of data before it's licensed, 8 weeks, and then we have to have at least a 2-year look moving forward, moving forward after it will be distributed.
Wonderful. Someone commented, the news reports that Pfizer upcoming vaccine is shown to be 90% effective already. Great news if it is believable.
Right. So right, Angelique. So that's what I was trying to sort of allude to in my answer before, was that's a preliminary look by what we call an external review committee. So the FDA has not finished their review, but that external committee that looked at it reported 90%. And I suspect that 94% from Moderna today is not a finished FDA review yet. So the reviews are ongoing, but they're working round the clock and rapidly. So hopefully we get those answers quickly. So there's more review. Those numbers got reported, so there had to be some review, but there's more, it has to be reviewed and re-reviewed and re-reviewed. And then you look at what's called, after you have the data set, you look at what's called subsets. So you can look at the general question, which looks at the whole set of 30,000 patients or 43,000 patients. And then you dig into the data and look for subsets. So you look for patients, for example, that have kidney disease. You look for patients with asthma and COPD. You pull them out and see what that data shows.
Thank you.
Mm-hmm.
Is it possible to be exposed to COVID-19 on day 0? I get tested on day 3 and get negative result, but show symptoms after day 3. You're absolutely correct. As I had mentioned, that the incubation time from when you get exposed to an infectious process to when you actually show symptoms, it could be from for COVID from 2 to 14 days. However, you do have the virus inside of you. So your COVID-19 test is done by PCR, which is amplifying. If you have a low amount in your system, it's amplifying that for the test. And you should still pick up a positive even though you're not symptomatic, which is how they were able to identify that 40 to 50% of individuals who have this virus, they don't have any symptoms. So, if you're exposed, yes, you have 14 days until you show the symptoms, but the virus is within, and when your test should show up as positive. We have been, not using like a test base because, each individual is so different. But testing is so important. Definitely testing is important. Continue testing for the COVID-19. But if you were checked, and if you haven't been symptoms developing, you should still show the positive test.
Right. Angelique, we're going to go ahead. I'm going to ask Brother Bill to open up the lines in case there's some individual questions.
Okay.
I think I'll share again a challenge that I have with, I guess, COVID fatigue for so many people. My staff were doing very well in their locations in one of my sites, that they would stay in their office, or if they came out, wear their mask. But one person was promoted, and they decided that they would have a little quick lunch celebrating her promotion. So there was 8 staff members, and what I found out is the next day one tested positive. So 8 staff members I have lost and will have to be in quarantine. And it's, again, not thinking, you want to do things normal, but you just can't do them now. And that was very tough for me as a broken leg director, trying to find people to fill in, and for a tough lesson for people who put themselves at risk just wanting to gather. So again, just kind of think through things and say, I might have to wait. This might have to wait. I might have to do things different because I want to protect ourselves. So we wanted to see, Brother Bill, you open the lines if anyone is able to, had a question that you're not able to be on the chat, but you had a question. We're going to open up for a few minutes.
Mom, I'm a student in a.
Sister Renee, it's probably going to be better to have people raise their hands and I unmute them individually.
All right, Bill, give those instructions, please.
For those of you who are on a device, a tablet, or a phone, please unmute yourself. Please raise your hand and I will unmute you.
So again, if you have a question, unmute, because we probably pick up some background signs so that we can make sure to answer your question. Raise your hand if you got a question.
There are no questions. Well, Sister Darcy, it's asking you to unmute.
Thank you. Good evening, everyone. Just really quickly, Dr. Guy, you were talking about the trial, the clinical trial for the vaccine. Can you please explain? I missed the first part of it where you said that the vaccine, something about 2 months before it could be released to the public.
Right. So the FDA. So yes, that's a great question. Thank you. So the FDA has made with a little faster track because we're in a pandemic and there's deaths worldwide. So the faster track is called emergency use authorization. But to get the emergency use authorization, after you complete your phase 3 trial, from the last dose of vaccine that's given, even in the phase 1, 2 to move on, they're gonna have to show that they looked at their study candidates for at least a period of 2 months, so we ensure some safety. So that some people do that, slow it down a bit, but we need 8 weeks. So and I looked at a webinar from the FDA this week, and they said they're not, if it's 7.5 weeks, fine, but it's not going to be 6 weeks. They want the full, close to the full 8 weeks, because that was some of the questions were, well, if it's shy of 1 day, because that could be, delaying it another 2 months, it's because you have to go back through all the data. But so it will be rounded off to 8 weeks. And then the other thing will be that you will have to look at for a period of 2 years at least in the phase 4. That means after the vaccine is already approved, but emergency use authorization or licensure, that you will be able to at least look at what's happening in what we call the post-marketing data to see if we detect some more rare safety issues, and also continue to look at efficacy. Really, you're looking at safety issues, adverse effects in the post-marketing part. So 8 weeks makes me feel comfortable that we're looking at so in previous vaccines, those time periods would be longer, but this is a pandemic. So, people that do this, scientists that do this, ethicists and all those sat around and came up with some things that would help us weighing the scale of, risk and making sure we stay safe, but we get a solution to this, to slow this pandemic down.
Sister Renee, we have about 15
Thank you,
people.
Dr.
We have about
One more question. Everyone else we're going to have to utilize the email so we can pull one more question, and then hubby will close out. We don't want to take advantage of your time. We appreciate you spending this time with us. One more question, Brother Bill?
You want to try it from the audio lines. If you're on an audio line, if you do a *6, I can see you when you come off of mute, and we'll allow you to ask your question.
If none, we have,
There's a bunch of them in the chat.
you have one.
I don't have one. No.
What we will do, and we appreciate it, we're going to take all of this information. It will be posted if you want to go back and review any of the information. Hopefully the timeline, we'll have it on the website, hopefully no later than next week. We'll have Brother Ron to share that information. And again, many of you know some of the schools are going to full virtual. We know Philadelphia has shut itself down, basically gone back to another phase. I would not be surprised if we do that in Delaware. Again, I can't emphasize enough, we all have to be part of this fight in order to get COVID-19 under control. I love and respect all of you. I don't want anything to happen to any of you. So let's continue to be safe. Angelique, is there anything before we ask the pastor to close us out in a word of prayer?
No, we've answered majority of all the questions, but because those who were on the phone, we're definitely have it posted and available for the website. So stay tuned.
Great, thank you. Sister Angelique is in charge of our medical team. We're going to close out, and I can call him Honey. Honey, can you close us out in a word of prayer? And thank you for allowing us to have this opportunity. And thank you for all of you who joined us this evening. We appreciate it.
Yeah, I got some background noise here at the house, but I'm going to close out in prayer. I do want to say to Vernell, there was a comment that he made that I think is very poignant.
Yeah, I did see it as
for
well.
the African American community, and he stated that since it is noteworthy to opine that there is a legacy of mistrust within the African American community in regards to medical institutions that emanates from the Tuskegee experiment. I believe that is true, and so we really do need to have the new presidential administration set a tone that will allow us to feel comfortable and to trust the science. Let's look to the Lord in prayer. God, dear God, we thank you for tonight and for these experts who are around the table. We praise you for the 100+ members of Bethel Church who thought it not robbery to get on this call, to get the education and to be updated. We ask your blessings upon us, upon our church, upon our world, our nation, our state and city. Keep us in your care for those that we've lost because of COVID-19, and there have been several. We lift those families up in prayer. We lift up in prayer tonight the family of Sister Ruth Robinson, who passed away, I believe, yesterday, and Brother Walters, who passed away today. We ask that you would bless their families. In Christ's name we pray. Amen.
Amen. Thank you all so much. Be safe, be well. God bless
Thank you,
you.
everybody.